Okay. Good afternoon. My name is Peter Hadden, and I'd like to talk about diabetes and screening and treatment in the South Pacific. So to put it into some context, the South Pacific's a big area. The Pacific Ocean covers half the surface of this planet, although it is not all ocean, but is instead dotted with many small island nations, especially in the tropical zone. However, the total population of Oceania is not much more than that of Kerala, and if you exclude Australia, PNG and New Zealand, it is less than Kochi. So we have a few patients spread out over a huge area, and this is a big logistical problem. Money is a problem for some of these small island nations, although many of them are dependencies, so healthcare is provided by their partner country, such as Australia, New Zealand, France, or the United States. There are also many other countries, China and the EU spring to mind, as well as non-governmental organizations such as Fred Hollows Foundation and the Mormon Church active in the Pacific. So I should give you a bit of background. What's life like in the South Pacific? Well, of course, there's Australia, and there's Sydney, and where I'm from, New Zealand, and this is the climate I'm more used to. But I want to talk about the small tropical Pacific Island states, which my wife and I love to visit with our children. So, although there are a couple of small cities, such as Apia on the top left, Suva in the middle, and Nandi on the top right, although I think most Indians would call them towns and small towns at that, most people in the Pacific live in villages such as the ones shown on the bottom. The church is very important to most Pacific Islanders, and the pastors are often the best placed people to know what is going on in their village and organise things like diabetic screening and treatment. I have to mention at this point that there's also a substantial Indian population in Fiji, and Nandi even boasts a Hindu temple, the largest, of course, in the South Pacific. So diabetes is a massive problem in the South Pacific. 29% of the population are diabetic. That's been estimated this year. Perhaps some of it is a genetic predisposition, but maybe not, because I've just heard that in urban India, the diabetes prevalence may be up to 30% too. Food is definitely a big culprit. So if you look at the 10 most obese nations in the world, they're all in the South Pacific. And of course, obesity is a huge risk factor for diabetes. Diabetes in the Pacific is often underdiagnosed, undermonitored, and undertreated. It is sometimes hard to even to get diabetic medication, and that can run out easily in the pharmacies. There's a lack of glucose monitoring, and people don't even know much about it. The culture also promotes big eating. For instance, after church on Sunday, everyone goes and has a big feed for the rest of Sunday. And if you don't partake and don't eat at all, that's just not done. There tends to be sugar in everything. And obesity, of course, also causes hypertension, which just makes your diabetic retinopathy worse. And in many places in the Pacific, there is also often no monitoring for a diabetic eye disease. So the sort of presentation we see is often late, with people having had little or no treatment, and obese patients are also difficult to examine, as I'm sure you can appreciate. So this is just patients I saw a couple of weeks ago in Samoa, sort of presenting for the first time just like this, with large exudation, or a bit hazy, or gross neovascularization, although these were just, 3 patients on one day. And many of them can be worse. This one at least hasn't got a total traction or retinal detachment on presentation. I'm sure that's not novel in India either. So what resources are there for these patients? So in the independent Pacific nations, Fiji being the most populous if we exclude PNG, is also the most well served. In 2 divisions of Fiji, there even is a diabetic photo screening service and a travelling eye bus, which you can see on the right. Other countries aren't quite so well served. Samoa only has 1 resident ophthalmologist, and that person is leaving. There are visiting ophthalmic teams that come several times a year, but really people have to be lined up by the ophthalmologist who's there already to sort them out beforehand, because it's difficult to just come do stuff and leave. They do have 10 eye nurses who do screening, and they travel around both islands of Samoa. Tongatapu's got one resident ophthalmologist, which is good. And the Solomons actually have more than that. And one of the Solomon Islands, or both of the Solomon Island ophthalmologists also do help out in other islands. In those nations that are dependent on another country, there is a better supply of ophthalmologists in the largest cities, especially in the French territories. And patients who have problems that can't be treated locally are sent free of charge to the partner country. American Samoa is just about to poach the ophthalmologist in independent Samoa by offering her a larger salary. And on the smaller islands, though, independent and dependent alike, although there are sometimes nurses who have been trained at the Pacific Eye Institute in Suva, in many cases there is no eye health service. Sometimes there are visiting ophthalmologists, and there's a boat that sometimes goes around providing eye care. You've got to also remember some of these islands are widely scattered. This island, Pitcairn Island, for instance, it's too far to fly a helicopter to Mangareva, the nearest island in French Polynesia. It's quite rugged, as you see, so there's no airstrip. So the only way you can get there is once a month on a boat, which takes 3 days to get there. Tokelau's the same, pretty much, boat. So it's very difficult to get patients to and from these places, or even people to there. Perhaps the most important eye institution in the Pacific is the Pacific Eye Institute, based in Suva at the Colonial War Memorial Hospital. It trains ophthalmologists and ophthalmic nurses for all over the Pacific. It's funded by both private and public organisations, mainly in Australia and New Zealand. Vitreoretinal surgery. In the independent Pacific, there's only vitreoretinal surgery available in Fiji, and then only by one surgeon. So clearly, if he goes, that folds. Patients can often be sent overseas if needed. If you live in French Polynesia or Samoa, you may be funded for that. But not all independent nations are like that. In some, for instance, like Fiji, you have to pay to go overseas and for your surgery, unless you're friends in government. I know also some patients are sent to India for treatment. So how can we change this? First, we have to reduce obesity, education, and restricting the importation of certain foods into these islands. For instance, condensed milk has been banned and turkey tail have been banned from Samoa. In Nauru, all citizens are encouraged to run around the airport once a day. Try to do that in India with your population. We also need to improve the management of diabetes and diabetic retinopathy by training more doctors and nurses. Perhaps even we could send trainee ophthalmologists to India, especially because you're the world leader in 6, which is mostly what's used in these small nations. And with the rise of the internet, we could make online lectures available, and organisations such as ours, RANSCO, or the All India Society, I'm sure, have a lot of resources which would be easy to extend to these islands. We also need to institute more screening for diabetic eye disease. And on some of these small islands, you don't necessarily need an ophthalmologist. You just need to take a photo, and that can be read somewhere else by someone else or by AI. And of course, we have to have more lasers closer, lasers and injections and things closer to patients, together with appropriate servicing of those devices, because that's an issue too. They break down. And we need to have people who are appropriately trained to do injections, which need not necessarily be ophthalmologists, but it can be eye nurses, and vitreoretinal surgery for everyone, not those who can afford it or are lucky enough to live somewhere that provides it. So, thank you.